What we know about Belantamab really comes from two trials. The first was the DREAM-1 study, which was a phase 1 trial trying to identify the dose that should go forward in trials. And what we saw is that in an early patient population compared to what we looked at in DREAM-2, the overall response rate was around 60%, and the median PFS was somewhere between 11 and 12 months. Now, in that same trial, if you look at a sort of penta-refractory patient population, it's a much smaller number than we studied in DREAM-1 in the whole trial overall. And what we demonstrated was that the response rate is somewhere around 35 to 40%, and median PFS is somewhere around 4 months. In DREAM-2, we were testing two different doses of Belantamab. One was the 2.5 mg per kg, the other was the 3.4 mg per kg, really to try and identify which was the safer dose to move forward to. And what was identified in that trial was that the response rate was relatively similar, about 30% in both, similar to what we've seen for every other approved drug in the refractory myeloma setting. Median PFS is somewhere around 3 months. But what I think is exciting is that it looks like the duration of response is going to be much longer, suggesting that patients that do get a response, that response can be quite durable. Now, if you begin to look at adverse events, there were two big categories that came up. One was ocular toxicity, which can be managed with dose modifications and dose adjustments. The second was hematologic toxicity, not unexpected given that it's an antibody drug conjugate, and that also is easily manageable by most hematologists. So I think Belantamab hopefully will be a very active drug for us, and again, combinability is what we're looking at in current trials.